Hello, this is the 10 o'clock news. My name is Faye Synan and today I will be talking about clinical governance.
Hi, I'm Dorcas. I'll be talking about audit in clinical governance.
Hi, my name is Cecilia and today I'm going to talk about practice application of clinical governance.
And I'm Becky and I'm going to talk about the rationale of clinical governance.
So Faye, what is clinical governance? Can you tell me a bit more about it, please?
Of course, Dorcas, I'd be happy to elaborate for you. According to Scally and Donaldson, clinical governance is a system through which NHS organisations are accountable for continuously improving the quality of their services and safeguarding high standards of care by creating an environment in which excellence in clinical care will flourish.
What?
Oh, I'm sorry. Was that a little bit too technical? Okay, let's break it down. So in basic terms, clinical governance is just a system that covers all areas, okay, which are continuously improving and changing. So this is for the best good. This is for the quality of care. So without clinical governance, our quality of care would never ever improve, because we'd be stuck in the Stone Ages, just treating people, shoving them out the door, and we'd have revolving door syndrome. So that's why clinical governance is there, alongside auditing, which we'll come to talk on about later. So I hope that's cleared up a bit for you, just improving the quality standards and making sure that we are ever moving on in medicine.
So Becky, why is clinical governance is very important in healthcare setting?
Well, Cecilia, according to the Royal College of Nursing, there are 5 key themes in clinical governance. These are patient focus, information focus, quality improvement, staff focus and leadership. So that I don't bore you all to tears, I will briefly explain these 5 themes. The first one is patient focus. Lord Darcy's report for the Department of Health in 2008 said that the healthcare settings should see that the key component for high quality care is what a patient experiences throughout their journey of care. This means that the NHS should prioritise improving a patient's experience. A direct quote from the Department of Health is, "It is about the patient's entire experience of the NHS and ensuring they are treated with compassion, dignity and respect in a clean, safe and well managed environment."
Wow, Becky, that was really interesting. Can you tell me more?
Yes, Cecilia, actually, there is information focus. This is to deliver public services. The government has created a new approach for data access. This means that public funds are being used in an open data strategy and a big data. So the open data is data that can be accessed and collected by the government, and it is made free to use and is able to be reused to develop public health services.
That was interesting, Becky. Do continue.
Okay, well, what about quality improvement? This is that research has been carried out and evidence given to provide high quality care. It is about learning from past improvements, initiatives in order for the healthcare service to pass on a sustainable and continuous improvement to uphold the quality within healthcare.
Oh, okay.
Well, we'll move on to look at staff focus. In clinical governance, it is imperative that staff are educated and trained to create a developed workforce for a good quality of care. To improve the patient's care, staff contributions should be recognised to continue with improvements and delivery of high quality care.
Fabulous.
And the 5th key is leadership. Stated by the Prime Minister's Commission on the Future of Nursing and Midwifery in England, senior nurses and managers should encourage quality from staff from the first point of care right the way through to the management board. The report discussed senior nurse managers have to take an acceptance in the full managerial accountability in the delivery of high quality care. Are there any relevant associated policies in clinical governance, Dorcas?
What is audit? According to Legg and Rothwell 2009, audit is the process that aims to improve the care of patients and their outcomes by systematically reviewing the care that they receive and comparing those care to a certain defined criteria that may result in the implementation of change. There are several forms of audit. The two most important types are clinical and surgical audit. Clinical audit simply refers to the larger picture. It primarily addresses the infrastructure of the hospital. The term surgical audit refers to the process of systematically examining the procedure concerned and comparing it to the whole gold standard.
So Dorcas, what are the aims and the processes of clinical audit?
The process of audit provides opportunity to highlight and address problem areas. There are 5 steps to do the audit, which is overall termed as the audit cycle. The first step is to identify a problem, and it's often identified by the clinical leaders who have an overall understanding of the situation. The next step is to define the criteria and the standard. The standard describes the level of care that should be achieved. The third step is to observe the practice and record the problem. The fourth step is to compare the practice audit results against criterion and the standard. The fifth step is to discuss and implement a change if necessary.
Dorcas, I really don't understand. Please can you give me an example?
Okay, for example, there has been an outbreak of infection on the ward due to nurses, let's say, not washing their hands correctly. This is where the clinical governance liaison would come in and do an audit by reviewing the technique used and implement a change if necessary.
Well, Cecilia, what are the practice applications of clinical governance?
According to SAM 2009, clinical governance is about the overall framework of the service the healthcare professionals provide and making sure they are as good as they possibly can within the resources that are available. It is important to look at the system and procedure and the information they get and review them by using complaint risk assessment as a lesson learned, rather than blaming people when things goes wrong. Example, complaining about a bad care given. So in that case, an auditing will be carried out to investigate the issue and to identify the opportunity for improvement.
So, Cecilia, how does understanding clinical governance actually aid practice?
Understanding clinical governance helps the practice to identify the potential risk by carrying out risk assessment and solve the risk by complying with clinical governance. Clinical incident reporting is required for staff and patients in highlighting any areas where individual or organization fails to deliver the appropriate standard of care. Incident reporting offers a framework for the detection of outward incident and near misses, which will enable action to be taken, lesson to be learned, practice to be reviewed, and information to be shared to prevent any reoccurrence.
Wicked. So what does clinical governance actually do in a practical setting?
According to Brand 2006, clinical governance is shaped by what individuals collectively do to make sure that care is safe, informed by evidence. So there are main components of clinical governance, including risk management. This is done to identify what went wrong during the care, understanding the fact that influenced what went wrong, learning lessons from any adverse event, and ensuring action is taken to prevent the same risk happening again. Good.
So is there any patient involvement in this or anything?
Yes, Faye. The Health and Social Care Act 2001 made it a legal duty of NHS organization to ensure that patient and carer were involved in and consulted about their care. This including gaining a better understanding of the appropriate and concern of those who use their service by involving them in their work. For example, in policy and planning care.
So just to conclude, that was our presentation on clinical governance, and I hope you all took away at least a bit of information about it. So that's goodbye from all of us. Bye!
Bye.